we get started. Good to have everyone here. We'll start with page 2 with Lawrence Richardson.
Good afternoon, Chairman Jones, members of the council. I'm here for Health and Human Services. The county administration is requesting a contract for taxi cab services from 3 different vendors. The selected vendors are WHC, Frederick Ellis, and Independent Taxi Association. These services are provided for transportation services for eligible Baltimore County clients. Due to a lack of comprehensive and coordinated transportation services, it is detrimental to clients and health and well-being if the services are not provided. So these taxi cab services are provided to increase adherence to medical appointments, visits with case managers, and other supportive services. The transportation services contracts have initial 1-year term with 4 one-year renewal options and a do not exceed limit of $380,000.
Okay. Are there any questions or comments from the members? Hearing none, thank you very much, Mr. Richardson, and keep up the good work. Have a long history with the county, and you've been doing a fantastic job. It's not every day I get a chance to see you, so I'll leave it at that. Thank you very much for the service you're providing to the citizens.
Thank you.
Thank you.
Sure. Next, we'll move on to Mr. David Likens, Director of the Department of Environmental Protection and Sustainability.
Good afternoon, Chairman Jones, members of the council. The administration is requesting approval of 3 contracts for on-call design and build environmental restoration services. The companies involved are Meadville and Kimley Horn, Triangle and McCormick Taylor, and EQR and Biohabitats. They're 1-year contracts with 4 one-year renewals. They're part of our MS4 program, mainly to design and build stream restoration services, but also for some of our other projects like maintenance repair of stream restoration and completed projects, stormwater retrofits, conversions of stormwater management ponds, outfalls, emergency repairs and vegetative plantings, basically all the stuff we do for MS4. And we did put out a request for proposals. That was the basis for the selection. And we had 7 submittals. And we set up a evaluation committee and reviewed them based on technical proposals from personnel, project experience and the references. We gave them some mock scenarios. We looked at their prices for design proposals and construction proposals. And included in this, I know this is very important to the county administrative officer, is a 20% WBE MBE participation. These are very large contracts. And actually we worked with Carla to have a 2-tiered process MBE system, where if it's a maintenance related task and it's under $100,000, we may not do WBE and MBE, but anything over that, it's strictly a 20% cost analysis or share of that. So these are very large stream restoration projects. We're talking millions and millions of dollars. An average might be $1 to $3 million for each project.
Okay. Thank you very much, Director Likens. Are there any questions or comments from the members?
Just a comment, Mr. Chair, to Mr. Likens.
Yes.
Really pleased that there was 3 stream restoration projects along the Glens Falls. So thank you to the administration, Mr. Likens. I think it'll go a long way into improving the flow of that watershed.
You're very welcome. We appreciate the support.
All right. Thank you very much. Move right along to Mr. James Benjamin. Have a couple of minutes. Contracts.
Thank you, Mr. Chair. Good afternoon, members of the council. The administration is requesting approval of a contract with Fremont and Graham to provide outside legal counsel with respect to a procurement lawsuit filed against the county. The contract will commence upon council approval and continue through the conclusion of litigation, including any and all appeals, with the option to extend the agreement an additional 90 days. Compensation may not exceed $90,000 for the entire contract term, including the extension period. I would note that several employees in the Office of Law are or may be material witnesses, resulting in a potential conflict of interest for the Office of Law, thereby requiring the county to seek outside legal representation here. Thank you.
Are there any questions or comments from the members? Thank you very much, Mr. Benjamin, and we certainly appreciate all of your all the heads up you've been given. Oh, go right ahead.
Thank you. I have another one. This is the administration is requesting approval of an amendment to a purchase order with Baker Donaldson, Bierman, Caldwell, and Berkowitz PC, which would include the terms of the written contract currently before the council for its review and consideration. This amendment is for Baker Donaldson to provide outside legal counsel services in excess of $25,000 with respect to a Public Information Act or PIA lawsuit filed against the county, as well as the director of the Office of Budget and Finance and the county attorney. The purchase order commenced September 3rd, 2021, but at that time, compensation did not exceed $25,000. Proposed amendment increases the maximum compensation to $250,000 for the entire contract term, which will continue through completion of litigation, including post-trial motions. In no event shall the total compensation paid during the entire term of this agreement exceed the sum of $250,000. Thank you.
Thank you. Are there any additional, are there any questions or comments from the members? Hearing none. Is that it, Mr. Benjamin?
Yes, it is. Thank you.
Thank you, sir, for all the briefings you've been giving us, keeping us informed. We appreciate it very much. Next, we'll move on to Ms. DeAndrea Walker, Acting Director of the Department of Public Works and Transportation. Today was a big day for that department. It was a big day for Baltimore County and a big day for Towson. And it was good to see you today. And where is Councilman Marks? Is he on the line?
Yes.
Councilman Marks, before we hand this over to DeAndrea Walker, why don't you go ahead and tell us about your day. Tell us about what happened today.
Well, various speakers were allowed to speak about how successful the circulator project has been and how we've gotten to this point. And I certainly share their enthusiasm. And I'm very happy for the Director Walker, your leadership on this, and many people who have contributed a lot of work in this project. So I thank you very much for everything you've done.
Well, we thank you, Councilman Marks. I was saying earlier today, if I had $1 for every time you talked about a circulator bus over the last 8 years, I'd be a rich man. So we're happy that it's here. Ms. DeAndrea Walker.
Thank you, sir.
Page 6, everyone.
Good afternoon, Chairman and members of the council. Today, the administration is requesting approval of 3 contracts to provide construction inspectors with specific areas of expertise as needed to inspect various county government construction projects. The 3 contractors are development facilitators, BOTA consultant engineers, and soil and land use technology. Each contract commences upon council approval and continues for 1 year and will renew automatically for 4 additional years. The contracts may not exceed $16 million for the entire 5-year, 4-month period. It's important to note that we have different level of inspectors. Level 1 inspectors will provide services for projects including construction, repair, and alteration of roads, bridges, and utilities and other public facilities, and streams and shoreline restorations and channel dredges. And then our level 2 inspectors will provide services for major construction projects, including water or sewage pumping stations, bridges, or similar type projects with a cost that's greater than $1 million. Funding for these contracts will not be encumbered at this time. Rather, the contract's costs will be charged as the project tasks are assigned. Each contract provides that the contractor is not guaranteed a minimum amount of work. The county awarded these contracts through a competitive procurement process, and it was based on the lowest responsive and responsible bids out of 9 bids received.
Are there any questions or comments? Hearing none, go right ahead, Mr. Andrew Walker.
The second contract we bring today is we're requesting approval of 3 contracts to provide on-call land survey and services. The 3 contractors are Walker Dent Surveying and KCW Engineering Technologies. Each contract again will commence upon council approval and will continue for 1 year with an additional 4 additional 1-year periods. Compensation for all 3 contractors combined is limited to the amount appropriated for the services for the entire contract. And our estimated compensation for all of the contractors combined is $1.2 million. Services will include topographical surveys, boundary surveys, construction stakeouts, GPS surveys, and 3D digital scanning. The county again awarded these contracts as well through a competitive procurement process that was based on our lowest responsive and responsible bid out of 10 bids received.
Any questions or comments from the members?
Yes, Mr. Chair. Ms. Walker, could you say the 3 companies again? Just want to make sure I don't have a conflict.
It's the one company is Draft Mercure Walker Inc.
Okay.
DIT Surveying and KCW Engineering Technologies.
Okay, thank you. No conflict for me.
Okay.
And Mr. Chairman, we just want to note that the similarity in the name of Walker, there's no conflict for Ms. Walker.
No conflict with Ms. Walker either. It's okay.
It's not a brother from another mother.
No, not today.
Okay. Any questions, comments from the members? All right, Ms. Walker?
Mr. Chairman,
Yes.
if I may, it's my understanding that Ms. Walker has requested that FM8 be withdrawn at this time. I believe we'll be getting a withdrawal memo that will be forthcoming. So I think you can probably just go right on to Resolution 133. Sure.
Okay. Okay, what about, nope, that's it. Any additional questions or comments? What I'll say, Ms. Walker, I know I said earlier that you are the true transportation professional, but you're a true professional all the way around with a specialty in transportation. How's that sound? Is that a little better?
That sounds great. Thank you, sir. I appreciate it. I appreciate the council's support rolling out the circulator today. It was definitely a partnership. We appreciate you being out today for sure. Thank you so much.
Mr. Jones, I will add also, Ms. Walker, you have always been professional toward me. You've always been fair toward me, and I greatly appreciate that.
Thank you. I appreciate working with you.
Mr. Chair,
Yes.
just a comment on how the county has come a long way in some regards. When we were when I worked in the planning department in the late 1990s, when we were putting together Master Plan 2010, planners, we really liked transit. And so we were inserting the word transit in much of that master plan. And we got a lot of pushback at that time. And I think, 20 years later, we're actually implementing transit in kind of in the center of our county. So I think congratulations to the administration, to Ms. Walker, to Councilman Marks, and to all of us for having transit in the center of our county and implementing it. I think it was the most recent capital budget.
Mm-hmm. Yep.
So we've come a long way.
Yep. So, Ms. Walker, I believe we have another one for you, Resolution 133-21.
We do. It's the Byers Farm
Sanitary sewer extension.
Right. Road sewers extension. This is a health project, and because of the nature of the project, there are certain requirements and benefits to property owners. In accordance with Article 20-2-101 and 20-2102 and 20-2105 of the Baltimore County Code and Department Policy, property owners must connect their property to the public sewer system and abandon the septic system. Connection to the sewer system must be within 1 year of the notice of completion and the release of the system. It's important to note that the annual sewer benefit and construction loan charges will be added to the property tax bill, which is issued July 1st following the notice of completion. The county does not require that these charges be paid off to sell or transfer the property to a new owner, except in certain situations involving property subdivisions and commercial properties. Owners of the residential properties may finance their plumber's bill for 40 years at 5% interest rate. This particular health project will be serving 5 improved properties. The construction cost is $428,000, of which the property owners will pay $219,000, and the county will be responsible for $208,000. And this is requiring council approval.
Chairman Jones.
Yes, go right ahead, Councilman Crandall.
Ms. Walker, thank you for this. We just received the fiscal note this afternoon, so it's just been going through it. So it did elicit some questions from me. So the $219,000 that the property owners are responsible for, should the council approve this measure, that's amortized over the course of a certain period on their property tax bill?
Over the course of 40 years at the 5% interest rate.
Okay. I guess my final question would be, and I know I can reach you offline if more questions come about, but so the fiscal note says that the extension is conditioned upon the holding of a public hearing. So is that a public hearing just among those homeowners? What are the logistics of putting that public hearing together?
We actually did the public hearing in August, sir. And
Very
it
good.
was,
Okay.
it was for those homeowners. And off the top of my head, all of the property owners were invited. Off the top of my head, I'm not sure how many came, but we invited them all, but it was just the property owner.
Okay. So, but that hearing was simply a hearing. It wasn't to take a vote on whether we're going to accept this or not. Due to county code, they really don't have a choice.
No, because it's a health project at this
Right.
point. Mm-hmm.
Okay. Understood. Thank you so much.
You're welcome.
Thank you, Mr. Chair.
May I ask a question of Ms. Walker?
Yes, sir.
So the county council approval is required for this. There's no way the administration could do this. We have to do this legislatively, correct?
Yes, sir.
We have
Approved
to
as
declare
part
the
of this.
public health emergency, right?
Correct.
Okay, thank you.
Mr. Chair, you're muted.
I have a question.
Thank you.
Yeah.
Yes, question?
Thank you. Deandra, I have a question. The health emergency, is it an emergency that has been caused by Baltimore County? I mean, does it involve the salt that we deposit on county roads during the winter?
No, sir. It normally
Good.
has. No, it doesn't have to do with salt from the winters. No, sir.
Good.
This is
Glad
all
to hear-
because of the sewer system.
Okay, good. Thank you.
Mhm.
Thank you, Councilman Katz. Any additional questions or comments? All right. Thank you, Ms. Walker. We'll
Thank you,
move
sir.
on to page 1, Bill 85-21, Councilman Quirk.
Thank you, Mr. Chair. Bill 85-21 permits by right certain uses related to transportation, storage, utilities, or other quasi-public uses in manufacturing light. Specifically, it permits a hospital by right, provided such use does not exceed 20 beds. This is something I reached out to the community on, reached out to the administration on, made sure Steve Lafferty's planning group was good, made sure social services was good. Administration is fully supportive. I'm not aware of any concerns by the community. And of course, this is helping bring another business in an area that definitely is trying to attract more business as well. So I'd ask my colleagues for their consideration. Thanks, Mr. Chair.
Thank you, Councilman Quirk. We do have a speaker. All right, no, before we go to the speaker, are there any questions or comments from the members?
Yes, Mr. Chair, I do.
Yes, Councilman Cran.
So I was contacted by someone who's looking at or the attorney for someone who is looking at a project such as this, a 20-bed hospital facility in a manufacturing light zone. And I think that the testimony that we're about to hear would probably relates to that particular project. But my question to that particular attorney was, under the county code or under COMAR or the state regulations, what is the definition of a hospital? And the reason for my concern is, I guess, or my question to our attorneys are, what is the difference between a hospital that I think that will be described in the testimony today and a state licensed medical facility that could potentially include things like a methadone clinic? Because methadone clinics, to my knowledge, currently are allowed in the MH zones in Baltimore County. And I want to see if this legislation would potentially open up ML zones to the placement of methadone clinics as state licensed medical facilities in the manufacturing light zones. So I hope my question was clear to our attorneys. I'm just looking for definitions and what the potential consequences should the particular use that is being sought by adding this allowed use in the ML zone could have consequences down the road that we may have concerns about.
Councilman, this is James. That's an issue that I would need to research with my team, and I would be able to give you my feedback or our team's feedback between now and the time of the vote. It would also be helpful to hear the testimony from this witness as well. But that's something I wouldn't be prepared to discuss right now. I would have to look at that information and then get back to you on that.
Very good. Thank you.
And Councilman Crandall, I'm definitely very open to looking at amendments, talking about this more. I know it's something that Larry Schmidt has also been working on, so we could also talk with him as well and make sure we get the language right if there's any issues here. Yep.
Okay.
Thank you, Councilman. Appreciate that.
Sure. Are there any additional questions or comments? Okay, we do have a speaker, Mr. Larry Schmidt.
Sorry for the delay, Mr. Chair. I'm trying to help Ms. Rogers get back onto the WebEx. Let me call Mr. Schmidt.
Okay.
Mr. Schmidt?
Yes, can you
You may
hear
begin
me
your
or see
testimony.
me?
Yes, we can hear you.
Okay, thank you. Thank you, Councilman Quirk, for that introduction. And Councilman Patoka, I went to the Ravens game last night and stayed till the bitter end, even when a lot of people left in the fourth quarter when they were behind by more than 2 touchdowns. So maybe I get something for that. I don't know. In answer to Councilman Crandall's question and just a little bit about this, it's interesting that the ML zone, as it's currently written, allows a wide variety of medical type uses, including doctor's offices, medical clinics, and it also includes alcohol and drug clinics under Section 4F of the zoning regulations. This really wouldn't change any of those regulations in answer to his question. The real distinction is if you look at the definition of hospital in the zoning regulations, it relates to an inpatient facility, whereas all those other facilities are generally outpatient. The ones that are either allowed or not allowed in the ML zone are basically outpatient. The particular project at issue that I'm involved with relates to a clinic that's presently existing in the Woodlawn area in Councilman Quirk's district, which treats adolescents and children. And it's a medical clinic there that treats children primarily for psychological type of issues, and not necessarily addiction. But my clients have told me that particularly during these COVID times and in the past year and a half, they've had a lot of patients of children who are suffering from problems because of isolation and the other things that we read about, even on the news, with children really not being in school or not being around friends and losing social contacts. And the children would be treated on an outpatient facility there. They propose conversion of their building, which is on a property of about 2.5 acres and is about a 40,000 square foot building, a portion of that, about a quarter of it, to accommodate up to 20 beds. So the purpose of this legislation was to narrowly tailor it to allow the kids who might need to stay overnight in the judgment of the healthcare professionals who are treating them, or who at risk, for example, to themselves, say if there's a child with a particular issue, so they can keep the child there on an overnight basis. We wanted to limit the scope of the legislation so as not to create large, huge hospitals in the ML zone like Franklin Square or GBMC. So it's limited to only 20 beds. But I think the impact of this legislation, in answer to Councilman Randall's question, is where medical treatment is allowed today in the ML on an outpatient basis, it will now be allowed on an inpatient basis at a facility of up to 20 beds. And other than that's the nature of the change, not expanding the type of treatment. It's more of inpatient versus outpatient facilities. That was the intent and the purpose of the legislation. As Mr. Quirk mentioned, when this came up, I appreciate all the efforts of his office, and we indeed talked. I talked as well to both Mr. Gutwald and Mr. Lafferty. Their concerns, I think, were the number of beds to make sure it wasn't a large-scale facility, and that's how we arrived at the 20-bed maximum. I'm happy to answer any kind of questions. But if you look at the zoning regulations, I think Mr. Benjamin was going to do it. Specifically, it's Articles 4C and 4F, which talk about both medical clinics allowed in the ML and also marijuana, cannabis for health is allowed in the ML. And then actually under the ML zoning regulations are where medical offices, doctor's offices are allowed as well in the ML. So this is just broadening that again from sort of those outpatient facilities to an inpatient, limited inpatient facility. That's the purpose. I'm happy to try to answer any questions about this project or anything else.
Mr. Chair?
Yes, go right here, Councilman Cat.
Yeah, Mr. Schmidt, can you tell me, will a CON from the state be required
Yeah.
for, okay.
Yeah,
Has it,
and actually, Councilman Koch, that was the genesis of this because a CON has been applied for. The name of the client is Hope Health Systems, and they operate the facility in the clinic in Woodlawn, and there's another clinic in Baltimore County, I believe, in Councilman Bevan's districts, and I think they have 2 facilities in Baltimore City as well. So they're a local organization. They applied for a CON, and as part of that process by the Healthcare Commission, they needed verification that they would be permitted under the local zoning ordinance. That's how they got in touch with me. I researched it, went to Mr. Gutwald, Mr. Lafferty, and ultimately Councilman Quirk. So their application is pending at the present time at the Healthcare Commission. It has not been approved because the use is not allowed under the existing regulations in the ML, but it's ongoing and under review now. If this legislation would pass, obviously they'd still have to jump through that hoop of the CON at the Healthcare Commission.
okay, thank you very much.
Thank you. Are there any additional questions or comments for Councilman Quirk or Mr. Larry Schmidt? Hearing none, thank you, everyone. Let me just take 1 moment, if I could, to just tell everybody that, we pray for the speedy recovery of the officer. There was a shooting in my district the other night at 2:00 in the morning where our officers came across some suspects robbing the 7-Eleven. They took off in their vehicle. They had a crash. They tried to flee. They came upon one of our officers. They fired upon our officer, who in fact returned fire and subsequently killing the suspect. And our officer sustained an injury, not from a bullet, but from basically evading or getting out of the path of fire. So we certainly pray for his speedy recovery and pray for some comfort for the family of it. So that's a reminder that our officers are out there each and every day working hard to keep us safe, putting their lives on the line. Any additional questions or comments before we sign off? Thank you very much, everyone.
Thank you.